Dear friends, it's a privilege that we are celebrating World Patient Safety Day, which is for the first time a very unique initiative by WHO to emphasize the importance of focusing on patient safety in our healthcare systems. We, in our day-to-day practice, always take those essential 6 patient safety goals, which include identifying the patient properly, making effective communication amongst the healthcare workers and the patient and family members, to ensure that high alert medications are given in an appropriate manner, to ensure that surgical interventions are done on the correct patients at the right time, on the right limb, and appropriately identified patients. Second last, we ensure that the healthcare infections are to a minimum acceptable level. And lastly, we have to ensure that the patient injuries related to falls are taken care of and prevented. Amongst them, of all these 6 major goals, effective communication amongst all the stakeholders would be the most important aspect. And I would say the most key aspect in ensuring patient safety at all times in the hospital stay. Effective communication actually begins amongst the healthcare workers and the team members who take care, and it very clearly entails clear, concise, written orders or verbal orders which are very clearly written down and passed in a very systematic manner in a handover between various components of the team. The communication network between various healthcare providers, consultants, the nursing staff and other paramedical people should always be very to the point and should have very clear-cut issues addressed. Communication with the relatives and the family member and the patient himself should be done in a very timely manner, in a very systematic way, and all the concerns about the disease, the treatment options and the prognostication should be done in a very timely manner, in a very calm, cordial atmosphere, and it should be well recorded for future references. Those high-risk interventions like surgical interventions, life support methods and other complex procedures should be detailed and discussed at length with a group of family members, especially the next of kin, if the patient himself is not in a state to give consent. And the informed consents should be very well documented and taken for every procedure. I would say in a nutshell, communication will actually be the center stage for all healthcare activities, and this, if it is strengthened well, will ensure that the bonding between the patient and the healthcare workers would improve, and a lot of problems can be easily mitigated and reduced. Thank you very much.